Okay, let's talk about mercury fillings now. We're just kind of checking off those lists. The root canal and the cavitation, or the bony areas where they didn't heal in the bone. It can happen for any tooth, by the way. Those are the hidden infections. Those are the ones that will take you down without you knowing. Mercury is a little less hidden. You can see it, right? Well, I want to talk to you about things that I can talk to you about. I actually can't tell you that this could affect your health. I still could lose my license, but I can tell you some things, and I will tell you those things. Number one, dentally. These mercury fillings are metal. So they're an amalgam or a combination of silver, copper, mercury, a whole bunch of different metals. Well, what does metal do when it gets heated up? It expands. What does metal do when it gets cold? It contracts. So this is inside of your tooth. What it does is cause cracking down the tooth because it's expand, contract, and it causes cracks in this crystalline enamel structure. So dentally, what we find is cracked teeth around mercury fillings. We also find cracked fillings, the fillings themselves cracked, and we find cavities underneath these because as they expand, contract, they form these little gaps between the filling and the tooth itself, and bacteria crawl underneath there, and you get a cavity underneath the filling. So from a dental standpoint, they really beat up your teeth. They're great to get removed. From a health standpoint, I can tell you because research has showed that mercury leads to brain fog, nerve problems, low energy, allergies, gut issues. Mercury is related to all of those, and mercury is released from these fillings 24/7. So what do? I tell people all the time, it's better to leave them in place than to have them removed not safely, because you're going to get a huge influx of mercury if you don't do it in a safe way. Please find someone who is, it's called SMART certified. SMART certification has a whole bunch of protocol for how to remove these fillings safely and not get more mercury into you. That is absolutely key. So make sure it looks like this when you're getting it done. All right. Can you heal teeth? People ask me this all the time. Can I heal my teeth? I see it on the internet. People are posting pictures. I can heal my teeth. My answer is yes, absolutely. But it goes back to that picture we showed at the very beginning. Remember which portion is the mineral portion of the tooth. That's the enamel on the outside. So again, remember, how is a cavity formed? If bacteria sit on the enamel, or if acid from bacteria or acid from your diet, or if your body just needs those minerals, all of the above, you could have minerals be dissolved from those teeth. Actually, I'm going to talk on that just for a moment because I just briefly glanced off of something. If you have absorption issues, meaning if your gut is not absorbing nutrients properly, your body, if it's not getting the minerals it needs, it will actually steal them or mine them from other structures in the body. Well, guess what two ready-made sources of minerals in the body are? Your teeth and your bones. So if you're getting tooth decay, if you're getting osteoporosis, most likely you have a mineral absorption issue, and your body's having to mine those minerals because you're not absorbing enough through your gut. So that's where you start working on gut function. I talk a ton about this, but gut function, gut absorption. So anyone that's starting to get a lot of cavities, particularly around the gum line, the first thing I say is your gut's not working, is it? And they'll say, how did you know? Because I know your body's stealing the minerals from your teeth right now to feed you. So let's feed your body and it will stop stealing minerals. So that's a really big cavity prevention piece, is let's stop stealing minerals. Let's actually get the gut working so that it can absorb what it needs. But now let's get back to, can you remineralize? So if your body's been stealing minerals, if acid has been dissolving minerals, can you put minerals back into the tooth? The answer is absolutely. The key is we have to put back what was lost. People will often say, well, that's when fluoride comes in, right? Well, let's talk about what fluoride does. Fluoride actually strengthens the crystal structure of the outside of the tooth. It strengthens the enamel. That could be good, right? It strengthens it, but it also makes it slightly more brittle. Here's the issue. It doesn't just affect the tooth. Remember, bones are made of the similar mineral structure that teeth are. So it's also affecting the bones, making them stronger and more brittle. There's research that shows higher incidences of hip fractures in areas that are highly fluoridated. So the more fluoride you have in your system, the greater chance you have of having a brittle bone. I'm not okay with that. There are other issues with fluoride. Fluoride interferes with thyroid hormone activation because fluoride and iodine's key for thyroid hormone, they're cousins. Fluoride's the meaner, bigger, older cousin, and he bullies iodine out. So low thyroid levels could be related to fluoride. There's so many things, and it makes me scratch my head because teeth are not deficient in fluoride. When you get a cavity, they're not deficient in fluoride. Remember, we talked about what they're deficient in. The minerals have been absorbed, been dissolved by acid or the body. Minerals are missing, not fluoride. Minerals are missing. So all we have to do to remineralize teeth is put minerals back. Which mineral is that? Hydroxyapatite. Remember, that's what the teeth are made of. We put back what the teeth had originally, not what they never had. They never had fluoride. Why have the side effects and all the other toxic effects of fluoride for this little benefit when there's something else to use that has no side effects? Let's just put hydroxyapatite back on the tooth. That's why I love my hydroxyapatite tooth powder. Can you remineralize? Yes, if the cavity is still in the outside layer, in that mineral structure, crystalline structure. Once the cavity's moved into that tubule area, remember I was talked about how it's a superhighway, it's spread everywhere. Once the cavity is moved down into that dentin area, it's going to be much more difficult to heal that area. So we try to catch cavities when they're small, little, so that we can put minerals back in. And that's so absolutely you can remineralize a tooth. All right, I know I'm moving quick, but I want to get to your Q&A in just a minute. So I've got to cover my last thing here. We've got to talk about sleep. And why is a dentist talking about sleep? Let's talk about it. First of all, how common are these issues? 2/3 of people have some sort of a sleep disorder, and most of us don't even know. 90% of us have no clue. 1 in 5 adults have mild sleep apnea. 1 in 15 have moderate. That's a lot. Most of us have no clue that we're having a sleeping issue. Honestly, this is one of our greatest public health crises. It leads to a weakened immune system, increased cancer risk, metabolic, endocrine issues, heart disease, diabetes, Alzheimer's. But this is the big one I like to point out. If you are not getting the oxygen you need while sleeping, you will have a 20% shorter life expectancy. This is shown by research. What that means is if you were going to live to 80, you're now going to live to 60. If you're going to live to 90, you're going to live to 70. Are you okay giving away 20% of your life expectancy? I'm just simply not. So let's talk about what we can do about it. Let's go past that one. Sorry. All right. Dental screening. This is why a dentist needs to be talking about this. We can see so many things, but you can see this at home. I want you to look at these pictures. When you say ah, the tongue should be in the mouth and you say ah. You should see what looks like on this far left. You should see a throat. We should see tonsils if the tonsils are still there. We should see the uvula. We should see all of that. Go all the way to the far right. When that person is saying, ah, all you're seeing is a swollen tongue, zero throat, zero room for air to get through. So this is something that we look at in just this initial exam even. Where this is called the Mallampati score. Where is the Mallampati? We want you to be 1, 2 at the very minimum. How do we diagnose these issues? A lot of times people have already diagnosed. By the time they've come in to see me, they say, my wife sent me in because I snore, or I wake up all night long. I wake up like 7 times a night to go to the bathroom, or I just can't go to sleep. I have to lay there for hours, or I'm taking Ambien and I have for years and I don't dare go off of it, even though I know it's not good for me, but I simply can't sleep. Or I wake up and I slept, but I don't feel like I did. I'm super tired. I just feel groggy all day long. These are all self-diagnoses of sleep issues. How can you officially diagnose it? You don't have to go to a sleep center anymore. We can actually do a home test now. Oh, too far. We can do a home test now. We even have a brand new one that's just a ring that you wear on your finger, and it can give actual sleep diagnosis just with that. We can send it to you in the mail. You do it home, you send it back, and we get an actual sleep diagnosis off of it. Is it important to have the diagnosis? I believe it is because it's measurable. Then we can tell if you're getting better or not. Sometimes we forget how bad we were when we're better. We go, I don't know if it really helped or not. Let's measure again and see. So it's nice to have a measuring tool. However, you don't necessarily have to have it to proceed through some of the treatment options. What are those treatment options? Well, most people know of a CPAP and that's it, right? They know that, okay, we can strap this thing on my face and it's going to blow oxygen down my pipes so that I can get enough oxygen. Huge issues with this. First of all, it's not addressing the source whatsoever. It's not addressing why is there not enough room for air to get through. That hasn't even been talked about. Second thing it does is when you supplement something artificially to the body, whether this be hormones or other nutrients or oxygen, when you artificially supplement that to the body, It turns off the body's own internal feedback mechanism, so the body stops telling itself to breathe because you're giving it the oxygen it needs. This affects breathing efficacy even during the daytime. This has some spillover effect. So now your body doesn't have to breathe because it's getting the oxygen forced down the tubes. So it kind of stops doing it all the time. You can start doing some sleep hygiene, where you're doing blue blocker glasses and take all the electronics out of your room and melatonin at night and cool the room down. I believe in all of those. I don't think that any of those are bad ideas. However, if the source hasn't been addressed, they may not actually take care of the problem. A mouth appliance that moves the jaw forward. That's another that often people will hear about. You wear a mouth appliance, it moves the jaw forward. What is that doing? It's opening up this section right here. That's your airway. It's making more room. That's getting closer to addressing source now. That's getting closer to it. But the problem with the mouth appliance that moves the jaw open, it's kind of like a knee that's been hyperextended or a shoulder that's been hyperextended long term. This is, in essence, hyperextending the jaw all night long. There are ligaments that hold all these structures in place. And if you hyperextend for too long, you'll get ligament laxity. You'll overstretch the ligaments, and the jaw starts to have jaw joint degeneration. Research shows about 2 years out. Do you really want to do that? Let's just address source. So what can we do? Well, one thing is we can use a laser to make more room in the airway. If you do that test and you look in the back of your throat and you can see no throat, we can actually shrink up some of those tissues. Interestingly enough, oftentimes those tissues are swollen because of all the things we just talked about. Dental infection. Think about if you have infection in the wisdom teeth areas. Where are the wisdom teeth areas? Way back in the back of the mouth. So that will cause swelling back here in the back of the throat. Remember that picture, how swollen that tongue and everything was? Often it's dental infection that's causing it. So that's the first thing we address is there infection in the mouth that we need to clear out, that we need to clean up? How do we clean up? We didn't talk about that much. How do we clean up failed root canals? There's only one way. Nobody likes me to say it, but there's only one way. We have to remove that tooth with all of those infected tubules. We remove the tooth, we replace it with a ceramic dental implant. It's a whole nother talk. I'm sure there'll be questions about that one. We replace it with a ceramic dental implant. Wisdom tooth areas, other tooth removal areas, we clean them up. We go back in, we disinfect them, we fill them up with stem cells so they'll finally heal. So that's the first treatment for sleep issues is, do you have infection we need to address? Do you have mercury fillings that we need to remove? Because it will affect brain function. It will affect the way the brain is stimulating the body to breathe, actually. That's all first. Then we say, okay, can we use a laser to shrink things up now? Now that the infection's gone, can we shrink up that excess flabby tissue? Do we need to actually do a tongue tie release? Is the tongue in the wrong place? Is it sitting down and back because it can't move up and forward? We assess this in children as well. Or do we actually just need to make the mouth bigger? Is there just not enough room in your mouth for your tongue, for all these tissues? We can do all of those things. In a child, look at the difference in this boy. Look at his eyes. Look at his eyes. Look at his jaw position. See how far back the lower jaw is? Because of growth and development, probably some nutrition issues, not because mom didn't feed him, but because the food we feed them doesn't have the nutrition in it anymore. This boy isn't sleeping. You can tell in his eyes, he's tired, he's fatigued, he doesn't feel good. His jaw is so far back that it closes off the airway. So we actually do growth and development appliances in children that help the area to grow the way it should. This is not genetic. This is not genetic because it will take multiple generations for these kinds of changes to show up. They are showing up in less than a generation. This is environmental. We are not getting the air we need, but jaws and mouths are not growing like they should because of environmental factors. Nutrition is a huge one. We need to identify this early in kiddos. Look at this young man, the difference in his face from left to right. Look at the difference in his mouth posture. If you are mouth breathing, if you have the short upper lip, any of these things, these are all related to growth and development problems. And this young man is not breathing. Look at in the bottom pictures, the change in his jaw position. It's just incredible, the things that change in the face. And then you see them here, but you feel them in the body. They breathe. They get the oxygen they need for metabolic systems. All of a sudden, the brain works better. Kids are focusing. Their ADHD symptoms are completely dissipating. They aren't wetting the bed anymore. All sorts of things go away when you can breathe. We can do the same thing in an adult. You can see the difference in this woman. It's absolutely life-changing, the changes it can make in a face, in a woman, in a life. We can change this with growth appliances, even in adults. Doesn't matter the size. You can see up top, this is a directional growth appliance for a child here. You can see the difference it's made. This is not braces. This is actually directing growth while the child is still growing. So much potential here. All right, I know I have moved quickly through things because I want to get to some questions, but I want people to look at this slide. If you want more information, like I said, there is so much information that I give away for free everywhere. Go to my website, go to all my Instagram, Facebook profiles, whatever. Take a picture of this QR code right now on the screen. If you've got your screen up, there's also a code for a free gut health guide. I talk so much about gut because I identify gut issues because I start to see cavities. There's so many connections here that I want you to really take advantage of and use this information. This is all of the places you can go find this. But I wanted to get to questions because I've been seeing people raising hands. I wanted to get to questions. I wanted to answer things that people are wondering about. So let's do that.